Hello dear students, this is the second lecture of pathology of the blood and lymphatic system. In this lecture we are going to discuss anemia of decreased production from the bone marrow, and they are generally classified according to the cause into nutritional deficiency, which is the most common one, then chronic inflammation, and the last one is the bone marrow failure. We would begin with the first and the most common type of anemia. It is iron deficiency anemia. It is the most common type of anemia worldwide and in all age groups. This is based on the community. So if you test normal people outside the hospital, you will find it as the most common type of anemia. This is in contrast to the next one, which is the most common inside the hospital. So community-based anemia, the most common one is iron deficiency anemia, and this is important in your clinical practice in the future to know which are the common anemias and which are the less common and rare types of anemias. This is why I began with this iron deficiency anemia as the first one to remember, as it is the most common type of anemia. I did not follow the outline in the textbook because they discussed it later on and they began with less common anemias. So let's go back. Iron deficiency anemia, it affects 10% of people in the developed countries and much more common in the developing countries, which can reach 50% of the population. We did a study in Jordan a few years ago in teenagers who visited the hospital, Jordan University Hospital, for routine visits, and we found around 30% of them to have anemia, both boys and girls. So it is a very common type of anemia. Iron normally it has a strict storage in our body. The pool of storage of iron is divided into ferritin and hemosiderin. Ferritin is a small molecule which is water soluble, so it is dissolved in the cytoplasm and we cannot visualize it, while hemosiderin is large and insoluble one. The main storage of iron takes place in the bone marrow, in the liver and the spleen. The storage forms around 20% of the total iron in our bodies. Most of the iron is present inside the RBCs, in the blood. This is the most common site of iron in our bodies. Okay, then we have the storage, which is around 20%, and the remaining few percent, or much less common, it is present in the serum as transferrin. We are going to discuss it. It is carried by transferrin, around 1% of the total iron, and we also have some iron in the enzymes, in the skeletal muscle, in the brain, and some other cells in the body. Hemosiderin is a large ferritin, multiple ferritin together, but with different characteristics. It has additional minerals, so it becomes insoluble. It has characteristic granular in shape. It is intracellular. Okay, it is located inside the cytoplasm of the macrophages in the reticuloendothelial system, which is the bone marrow, liver and spleen, and we can see it by the light microscope using a special stain. For ferritin, as we mentioned, it is part of the storage and also it circulates the serum. Okay, the ferritin in the bone marrow, it detaches and it goes into the serum, and this indicates the status of ferritin in the bone marrow. If we take a serum from the patient and we measure the ferritin, it tells us how is the status of iron in his bone marrow. We have a lot of tests for iron to examine the iron in our bodies. The most accurate one is to go directly to the bone marrow, and we take an aspirate, okay, and we stain it with the special stain is called Pearl's Prussian blue. Pearl's Prussian blue, because normally the iron doesn't stain with the routine blood film, which is Giemsa or Leishman stain. So we have a special stain for iron which turn into blue. If there is iron, it appears as blue in color. So if you want to test if the storage of iron is good or not, we go directly to the bone marrow. This is the most accurate one. Okay, so any decrease in the iron in our bodies, it starts to decrease in the storage in the bone marrow. So if we find it decreased, then the patient has decreasing iron status in his or her body. The problem with this test, it is an invasive one. Okay, it is invasive. We use a needle, we introduce it inside the bone, so it is not comfortable, it is painful and also expensive. So we have other tests that start with, we go to the serum, okay, from the venous system. We measure the ferritin there. As we mentioned, when the serum ferritin, it reflects the status of ferritin inside the bone marrow. So it is the second decreasing one in the body after the bone marrow storage. Okay, so if we have an iron deficiency anemia, we find ferritin is low in the blood. The problem with ferritin that it has other factors that can affect its level. Okay, they are mentioned below. Ferritin is an acute phase reactant, so if the patient has inflammation anywhere in the body, it will increase. Okay, it is released from the liver also, so it increases. Fasting also increases the ferritin level, while vitamin C, if there is deficiency, it will decrease. If the person has vitamin C deficiency, the serum ferritin will be below the normal. And also in pregnancy, especially in the first trimesters, the lady will has normally decreased ferritin due to dilution, okay, because they gain more fluids in their body, so the ferritin will decrease. So this is the problem with ferritin. However, it is commonly ordered in medical practice, and once it is low, this means that the patient has decreased iron storage in the bone marrow. We have serum iron level. Okay, it's different from ferritin. Serum is bound normally to another protein, is called transferrin. Okay, transferrin, it carries iron. So if we measure the iron, it will be decreased. However, this takes a longer time. Yani patient, the decrease will begin in the bone marrow, then it takes time until the serum iron to be decreased. So if the patient, if you measure serum iron alone and it is normal, this can be a false normal reading, okay, because it takes a longer time to decrease. في عنا الترانسفيرين, which we mentioned, that carries the iron. We can test how is it saturated with iron. Normally, this transferrin, 30% is full or is saturated with iron. This is the normal ratio. Okay, normally 1/3 only is filled with iron. So if we have decreased iron in iron deficiency anemia, then the transferrin saturation will be below 30%. There is another test called total iron binding capacity, TIBC, total iron binding capacity. هذا هو الوحيد اللي بيزيد في iron deficiency anemia. This test is an old one and it is reliable most of the time. هذول كانوا, we take the patient's serum and we artificially add iron to it, and we see how many of this iron can bind to the transferrin there. Okay, so if the patient has iron, the iron level is low, then there is increased capacity to take more iron from the lab. So this is the one, indirectly, it means the transferrin is empty and we can give much more iron. The test is an old and reliable one, and we still use it. The new tests, في عنا serum transferrin, okay, that carries the iron. في عنا كمان transferrin receptors. both they are synthesized in the liver and secreted in the serum. So when the patient has iron deficiency, the liver tries to compensate for it by synthesizing more transferrin and more transferrin receptors and secreting them into the blood to help other tissues to gain more iron. These tests, هذول new tests, they are now available, okay, but they are still expensive because they are new. We can go directly and measure the transferrin and its receptor, and both of them, they are increased in iron deficiency anemia. Remember, this is like an adaptive and compensatory mechanism. Other new test is reticulocyte hemoglobin content. In addition to normal RBCs that we measure the mean cell hemoglobin, which we mentioned yesterday, now we can measure also the characteristics of the reticulocytes, which, as we mentioned, they are less than 2% of the normal population of RBCs in the blood. If the iron is decreased, the hemoglobin is decreased in the reticulocyte, this indicates an iron deficiency in the body. Okay, this test, commonly it is abbreviated as CHR. Okay, CHR, it means reticulocyte hemoglobin content. And another parameter is the volume or the size of the reticulocytes. So if the patient has iron deficiency, it will be smaller than the normal, even the reticulocyte, so it will be decreased in iron deficiency anemia. So remember, most of the parameters they decrease. اللي بزيد عنا بس اللي هو total iron binding capacity and serum transferrin and transferrin receptors. Now in this slide, this is a particle of the bone marrow. Okay, we take it from the patient by a syringe or a needle, then we put it in a slide. We do not give the Giemsa stain, the routine one. Instead, we use what we mentioned as Pearl's Prussian blue. Sometimes we call it only Pearl's stain, or sometimes Prussian blue or iron stain. So this blue lines, these blue lines, as we mentioned, it is granular. Okay, it indicates the presence of iron. This is a normal situation, a normal healthy individual. You can easily see the iron, and remember, these lines indicate the macrophages in the bone marrow. Now in comparison, this patient has iron deficiency. As you see, there is no any blue line there, so this means the patient has iron deficiency. Now for iron homeostasis, normally we do not have a normal excretion method for iron. We cannot excrete it outside the body as in bile or as in sweat or as in urine. Instead, the only way to lose iron is by the shedding squamous and mucosal epithelium. Okay, they have already some iron. The mucosal layer في GI system, especially في الintestine, remember, من هناك بيبدأ الabsorption. Okay, so they have iron, these cells have iron, and they have a rapid turnover. They live only for 3 to 5 days, then they die and shed outside the body, so they take the excess iron. So if there is excess iron in the bone marrow, it is difficult to excrete outside the body. Dietary iron can be in two forms, either heme, okay, هذا بنشوفه بالred meat, liver, okay, موجود, وهذا it has a bioavailability of 20%. يعني if you take 100 gram of red meat, there is 20% of the iron there, you can absorb it easily. While the non-heme iron, we also called inorganic, this one is a vegetarian iron. It is difficult to absorb in human. Only 1% of this can be absorbed in the GI system, and this one is plenty in the spinach, in the lentils, beans. They all have iron, but the absorption is not effective well in humans. There is a hormone called hepcidin. Hepcidin is a hormone secreted from the liver, and it inhibits iron absorption from the gut. هاي الفانكشن تبعت الهيبسايدين. It degrades ferroportin carriers on the enterocytes, so these cells they cannot transport iron and it sheds away from the body. Hepcidin increases in special situations, okay, if we have a high serum iron in the blood, or if we have inflammation, okay. Interleukin 6, which is a chemokine that increases in inflammatory reactions, it will activate hepcidin and it inhibits thus the iron absorption from the gut. Low hepcidin occurs when there is an iron deficiency status in the body, and sometimes in some diseases like thalassemia and primary hemochromatosis it becomes very low. So these factors, you have to know what changes of hepcidin in relation to other situations in the body. What are the causes of iron deficiency? The first one is chronic blood loss, and we mentioned this earlier, okay, because it is difficult to regain this loss of iron. Diet, if the person eats a lot of vegetables at the expense of meat. In infants, okay, the human milk has low amount of iron, so if the infant is exclusively dependent on the milk, they will develop iron deficiency anemia. Teenagers, it's a bad habit. They have usually a bad habit of eating. They like junk food, they don't eat properly, they skip meals, so at the end they will end up with iron deficiency. Another cause is decreased absorption. Okay, any problem in the GI system, in the absorptive part, it will end up with iron and other nutrient deficiency. If the patient has gastrectomy for any reason, like cancer or obesity, بيعمل عملية عشان to lose weight, okay, there will be less amount of acids in the stomach, which is important for absorption of iron. Another situation is called hypochlorhydria. Okay, this is an acquired disease where there is destruction of the parietal cells and there is no enough acid in the stomach, and thus the patient will have iron deficiency. Intestinal diseases, okay, راح تاخدوها بالGI system, like celiac disease, دول كلهم decreased, there will be a decreased absorption of nutrients. In the elderly, as a normal aging process, the function of the stomach and the GI system will decrease, and it commonly has, the patient will have a lower level of iron. And they have also comorbidities, other diseases, which can result in chronic blood loss. Increased demands in certain situations, the body needs more iron, like in growing children, pregnancy, and in bone marrow neoplasms, the chronic ones, okay, بنسميهم myeloproliferative neoplasm. في عندنا more need for iron, وبالتالي the patient will develop iron deficiency. في less common causes, if there is a decrease in the transferrin, hypotransferritemia in the blood. The transferrin, as we mentioned, it is synthesized in the liver. So if the patient has a liver disease, there will be few amount of transferrin. If there is a protein deficiency, okay, like in the diet, it is absent. هذا يصير في الفامines, في very poor areas. Malabsorption, okay, it will also can result in protein deficiency because the liver uses protein in synthesizing these enzymes. أحيانا بصير عنا loss in the urine. Transferrin is lost in the urine. هاي بتصير في a disease, it is called nephrotic syndrome. في عنا certain diseases في الكدني, مش جميعها, okay, بكون عنا protein loss in the urine. basement membrane في الكدني بصير فيه damage, okay, it can lose large particles من بينها transferrin. هذول patients with nephrotic syndrome, commonly they have iron deficiency anemia because they don't have transferrin in the blood. آخر كاتيجوري بنسميها اللي هي الانزيماتيك deficiencies, الانزيمز that are responsible for الابsorption of iron في الجي اي system, في الترانسبورت هدول in general they are very very rare and they appear very early in life okay في الانفants and it cannot be corrected by الاورال ايرون. اذا اعطيناهم اورال ايرون ما بيستفيدوا منه اوكي. فهاي they are rare but keep it in your mind. Morphology of iron deficiency anemia. The RBCs they appear small and emptier than the normal. This and we describe it as hypochromic and microcytic. Remember hypochromic يعني عنا ايش الcentral pallor more than 1/3 of the full diameter. Microcytic it is smaller than the normal RBC يكون less than 7 micron. A common feature في iron deficiency بنسميها poikilocytosis. Different shapes okay for unknown reason. في iron deficiency RBCs they take other forms other than the round biconcave contour okay. بصير عنا يطلع اشكال ثانيه more angular and we call this poikilocytosis and it is measured by the RBC distribution width. We mentioned this in the last lecture RDW and it is increased in iron deficiency anemia which means there is a variation in the size and shape of the RBCs. يعني another cell is called target cell okay. Target cell it is an RBC in the center exactly there is a red dot red point there okay. بعدين بيجي central pallor بعدين another red area like the target that we shoot against. فهاي target cell it appears in iron deficiency وكمان later on نحكي عن الثلاسيميا والسيكل cell. So any abnormal hemoglobinization في الcells it will result in target cell shape. Low reticulocytes هاي في جميع الكاتيجوري اللي حكينا في decreased and diminished production راح يكون reticulocyte is low. Although the erythropoietin is high نتيجة الأنيميا it is not effective. It cannot activate RBC production. Imagine it as you have as the car engine needs fuel to operate okay. محرك السيارة بيحتاج إلى الوقود. if you don't have the fuel اللي هو الأيرون then the motor or the engine cannot operate well. So the same concept if we have erythropoietin it cannot activate the bone marrow to produce RBCs. طيب في عنا last feature وهاي if you know it well يعني بتكون بتساعدكم in the clinical life to know that this is iron deficiency. Commonly they have thrombocytosis okay. مع الأنيميا بيكون عنا increased platelets and this feature it was enigmatic مش معروفة why. كان في عنا theories إنه erythropoietin can activate megakaryocyte but it doesn't explain why it occurs only in iron deficiency anemia. Recently in this year okay they found that in the bone marrow when the iron amount is low this shifts the progenitor cells اللي هم early cells like the stem cell into the megakaryocytic line instead of the erythroid. يعني لما يكون عندنا الميديوم في البون مارو is low in iron بصير عندنا more dominance of megakaryocytes. هاي بتبدأ في الستيم cells تبعنا okay. So it is not related by the erythropoietin. So remember in the thrombocytosis is a feature of iron. And also in the previous slide هدول حكينا عنهم poikilocytosis okay. So most of the time هدول they appear in iron deficiency anemia while in thalassemia راح نحكي عنها later on. In thalassemia the blood film is very similar to iron deficiency. However في thalassemia minor we do not see these changes in the shapes. Symptoms of iron deficiency anemia. أهم إشي تعرفوه first thing is it is a chronic disease okay. Iron it needs a long time until it is depleted in the body and the RBCs become hypochromic and microcytic. هاي ما بتيجي بين it doesn't come suddenly or quickly within a few days. Iron deficiency anemia develops into a long time so it is a chronic anemia. And patients have general symptoms of anemia that we mentioned in the previous lecture اللي هم pallor, headache, okay, tachypnea, tachycardia if severe. Now في عنا special symptoms, okay, في iron deficiency anemia. First one is called pica. Pica, it means the patient likes to eat abnormal things. They are not normal food. Abnormal things. The most common one is ice. أكثر إشي الإيس. بحبوا they like to eat ice. Some patients they like to eat dirt. Okay, dirt or paints from the wall. بصير يشيل من الحيط ويأكل منه. فهاي we call it pica, and it appears for unknown reason in iron deficiency anemia. Glossitis and stomatitis. Okay, glossitis inflammation of the tongue. Stomatitis اللي هم inflammation of the lips وبيكونوا عادة في angle of the lips. فالiron deficiency anemia إذا كانت severe, patients will develop these symptoms. Again, it's not fully known why, but it is thought that the iron is important for the stability of the epithelial cells. Spooning of the fingernails. Fingernails بيصيروا very thin, okay, brittle, بينكسر بسهولة, and there is depression in the middle, so it takes the shape of the spoon. It becomes more round and depressed. So this is called koilonychia or spooning of the fingernails. Another symptom اللي هي restless leg syndrome. It was found statistically to be common in patients with iron deficiency. يكون الشخص he or she is sitting and moving his leg quickly all the time he is sitting. Okay, it was found for again unknown reason with iron deficiency anemia. Hair loss. Okay, the same thing, it is important for the epithelium. Blue sclera, again we have epithelium here, and because there is iron deficiency, the sclera اللي هي the white part of the eye, it becomes very thin, so it gives the shadow behind it, it appears more blue in color. آخر إشي weakened immunity. Remember إنه الأيرون is important for the immune system. زي ما حكينا الماكروفاجز they store iron and they utilize it, وهي راح نحكي عنها later on في ال next disease إنه immune system they utilize iron very effectively and against the microbes. آخر شيء cognitive impairment. الأيرون حكينا داخل it is present in the nerve cells في ال brain, and the details of these symptoms it's not known now, but it can, if it is severe, it can cause impairment of the cognitive function of the brain. The second anemia اللي هي anemia of chronic inflammation. اسمها الثاني anemia of chronic disease. Okay, but the more accurate is anemia of chronic inflammation, لأنه it needs the presence of inflammation for a long time to appear. Some chronic diseases we do not have inflammation there. Okay, زي degenerative diseases ما بيكون فيها inflammation, they don't have this anemia. So this anemia appears if the patient has a chronic infection. Okay, example عليها tuberculosis, brucella, okay, HIV كلهم chronic. cancer, دائما cancer بيعمل لنا inflammation نتيجة الدمج في التشو. chronic immune diseases اللي هم ال autoimmune diseases, most of them they are chronic زي rheumatoid arthritis, systemic lupus, erythematosus, هذول كلهم بكون عندنا inflammation دائما. بكون عندنا inflammation, then the patient will have anemia. This is the most common type of anemia in the inside of the hospital. في ال inpatients, okay, patients that go and have to stay inside the hospital. لأنه most of them they have either one of these diseases. Okay, so it is very common in the inpatient setting. طيب, pathogenesis, why anemia develop? Because there is an inhibition of the erythropoietin synthesis from the kidneys. Okay, chronic inflammation it suppress erythropoietin. في عندنا increased interleukin 6 نتيجة الانفلاميشن بيزيد, راح يزيد عندنا الهيبسايدين. اوكي, الهيبسايدين it antagonize الاريثروبويتين, فإذا زاد عندنا راح يصير عندنا suppression للاريثروبويتين, وفي كمان الهيبسايدين زي ما حكينا it blocks transfer أول إشي iron absorption from the gut, and it also blocks the transfer of iron from the macrophages اللي هم storage area to the red blood cells precursors في البون marrow. okay, فالايرون it will stay in the macrophages, بالتالي ال RBCs they become deficient in iron, so it will end up like in iron deficiency anemia. So hepcidin it is increased secondary to inflammation. It will inhibit the synthesis of erythropoietin and also inhibit the take of the iron intake by the RBCs. Laboratory findings, it is very similar to iron deficiency anemia. Okay, the serum iron is low because it is retained in the bone marrow. Transferrin saturation is also low لأنه ما عندنا serum iron is enough. The RBCs they begin في the beginning of the anemia it is normal in morphology, but with time they become hypochromic and microcytic. Reticulocytes are low because we do not have enough erythropoietin. So what is the difference between iron deficiency anemia and anemia of chronic inflammation? أهم إشي اللي هو bone marrow iron stores. In this disease it is increased. Okay, as you see in this picture it is very blue من ال low power, you can see it بالnaked eye حتى بكون مليان iron. Serum ferritin is also increased. Remember إنه بيزيد بالinflammation فهو already increased, and we have more ferritin here, so it goes to the blood and we can see it high. فهاي discriminator if you take the blood sample مع إنه iron low بس الferritin is increased. Serum transferrin is low. okay, هاي عكس iron deficiency anemia. بالتالي total iron binding capacity is decreased عكس iron deficiency. هناك كان عندنا a lot of transferrin, هون we do not have enough transferrin, so if we give artificially iron it cannot bind because we do not have transferrin. في عندنا transferrin receptor, هذا new test زي ما حكينا. In this disease it is normal بينما في iron deficiency it is increased. I'm sorry, أنا transferrin receptor is normal. okay, بينما بيكون زايد في iron deficiency anemia. Transferrin saturation is normal. okay, لأنه saturation it reflects serum iron and transferrin level. So when they are both low the ratio becomes normal ما بتتغير. okay, transferrin saturation اللي هو عندنا serum iron and correlated with the transferrin level. When they are both decreased then the ratio remains the same, so it is normal. Transferrin receptor again normal, and high discriminator from iron deficiency anemia. So why is this process is taken, and what is the significance of all of this, these changes? ليش بتصير هاي الأنيميا؟ The most important theory إنه iron is useful for the body, especially for the immune system, so they take the iron and keep it to themselves هدول cells, and to depleted ما يعطوهم, there is no chance for the microorganism, especially bacteria. Iron is important for the survival of bacteria, so they cannot take iron from the body. عشان هيك iron is kept inside the macrophages في البون marrow and it is not given to the body. عشان هيك liver it will not synthesize transferrin. okay, عشان يحمي الجسم من إنه هاي iron ما يروح, doesn't go to the microorganism. طيب, in this diagram it is a summary of the changes and differences. Normally عندنا iron in the blue one هذا بيكون في الهيم هو most common, بينما purple اللي هو storage زي ما حكينا around 20% of the total iron. في iron deficiency serum iron or the hemoglobin it is decreased as you see compared to the normal, but the storage is absent خلص كله. Anemia of chronic disease لا, storage is kept and even more it becomes increased. okay, بالتالي we have a deficiency in the hemoglobin iron. آخر disease هذا we are not going to talk about it. في hereditary hemochromatosis بيكون عندنا marked increased storage. okay, الأيرون بيزيد في الستورج and also in the blood. Next we'll talk about megaloblastic anemia. This is again a common anemia. It is caused by deficiency in either vitamin B12 or folate, or together, both of them. What is the function or the importance of these vitamins? They are required for the synthesis of thymidine, okay, nucleic acid, and thus when there is deficiency in one of them, there is no enough thymidine, and thus the DNA replication becomes impaired. بصير عندنا abnormality في replication. If كل ما كانت deficiency أكثر بصير عندنا less amount of DNA. The abnormality occur in all rapidly dividing cells. Okay, زي ال GI system. بس the hematopoietic cells, they are the mostly affected ones. Okay, لأنهم أكثر خلايا بيستخدموا these vitamins, and they are also rapidly dividing. It is a very active organ in the body. But yet, the epithelium, سواء بالskin or the GI system, it becomes affected, and we'll mention this في symptoms. So the maturation of RBC progenitors or precursors في bone marrow is abnormal. They cannot mature normally. Nucleus is defective. It doesn't have enough DNA. So many of the cells, they die early inside the bone marrow itself. فبنسميها ineffective erythropoiesis. هاي معناها ineffective erythropoiesis. It means the RBC progenitors, they die early. They cannot compensate the anemia, and they by themselves they die early. And this will lead to minor hemolysis. When they die بصير لهم hemolysis. Okay, ففي عندنا minor component of hemolysis in this disease, but it is mainly a disease of decreased production. والهيموليسيس بصير inside البون مارو بعكس الهيموليتيك انيميا اللي راح نحكي عنها later on. The viable RBC progenitors or nucleated RBCs, if they still viable, اللي هم عندهم the residual vitamin B12 and folate, they take a longer time to mature. Okay, they take a long time to synthesize the adequate DNA, and this will result in the typical morphology of megaloblastoid. عشان هيك they appear larger in size. هاي معنى mega, and blastoid معناها immature. Nucleus تبعتها is still immature, not like the normal one. So this is why the cells appear larger in size, سواء ال RBC or the white blood cells وحتى ال epithelium, because they take a long time until they are mature. Folate deficiency. Normally there is a small amount of folate in our body. It can be stored in a small amount, and there is a high turnover. Folate, it can be depleted quickly, and we can replete and replenish it and نعوضها again quickly. Folate is vastly present في food, but most commonly موجود في green leaves. The problem, it is destroyed by cooking. عشان هيك if you eat fresh green leaves like lettuce or what other things, you can take a good amount of folate. What causes deficiency? أول شيء decreased intake, dietary intake. This is a common reason for any deficiency in nutrition. Increased demand, high في pregnancy. Okay, زي ما حكينا folate, we have a small amount, and it has a high turnover. بيحتاجوا الجسم كمية كبيرة. So pregnant lady, أول ما the first thing to take في supplements اللي هو الفوليت. Okay, they need it for the DNA of the baby. في الكرونيك هيموليتيك انيميا راح نحكي عنهم later on. دائما ما دام في عندنا hemolysis في عندنا damage لل RBCs, so we need more RBCs. البون marrow when it is very active, it needs more folate. عشان هيك الكرونيك هيموليتيك انيميا commonly they have folate deficiency. بصير عندنا picture of mixed anemia. Intestinal diseases محل من absorption of folate. Okay, في عندنا some nutrients or drugs, they inhibit the absorption of folate. Beans, okay, legume, and alcohol. Alcohol in large amount, and it inhibits the folate. Phenytoin هذا anti-epileptic drug. دائما when it is given they give the patient a high dose of folate because it inhibits its absorption. في عنا الميثوتريكسات اللي هو anti-neoplastic drug. This one inhibits the metabolism of folate. يعني حتى لو صار له absorption في ال GI system, when it reaches the cells it cannot be utilized. Vitamin B12 is mainly present in the animal products. Okay, strictly in the animal products. ما بيكون موجود vegetables. It is stable, resistant to cooking. It can be synthesized by our normal bacteria in the bowel. Okay, أيام زمان in the old ages ما كان عندهم good exposure or good enough amount of meat like in these days. Still they didn't have vitamin B12 deficiency because they take it from the bacteria in the bowel or even from the contaminated water. زمان sanitation of water ما كانش perfect like these days, so it is commonly polluted by the excretions from other humans, فبكون طالع مع البكتيريا and they gain vitamin B12. Vitamin B12 is stored in the liver in a huge amount, enormous stores. Okay, but once the patient has deficiency, this means that the deficiency already took a long time. Okay, أكثر من الأيرون. It is supposed to be around 1 year or more. If you cut down and you do not take vitamin B12, okay, it takes around 1 year until you have this anemia. Now, what causes deficiency in vitamin B12? Either by the diet, and this occurs in vegetarians. They don't eat animal products like meat, eggs, milk. All of them, they have vitamin B12. But more commonly, بيكون عندنا problem in the absorption. The most important disease اللي هو pernicious anemia, الأنيميا الخبيثة. Pernicious anemia, this is an autoimmune disease, autoimmune gastritis. Okay, في عنا autoreactive T lymphocyte. هاي T lymphocytes, they recognize the parietal cells as abnormal. They causes direct damage to the parietal cells, which synthesize the intrinsic factor that binds vitamin B12. Okay, so this is an autoimmune disease. The T cells, they destroy the parietal cells, وبالتالي بصير عندنا deficiency بالintrinsic factors that are important for absorption of vitamin B12. Also, these autoreactive T cells, they activate the B lymphocytes and the plasma cells to synthesize antibodies against the parietal cells to cause further damage, or even against the intrinsic factors. يعني حتى لو طلع عندنا intrinsic factors somewhere else, في عندنا antibodies, they coat these intrinsic factor and inhibit binding to vitamin B12. There is a third type, حتى لو صار binding, it binds the entire complex. يعني لو B12 مسك, it catches the intrinsic factor, it binds the entire molecule and inhibits absorption. So this is an autoimmune disease and it will result in megaloblastic anemia. What are other causes? زي ما حكينا, if the patient has gastrectomy because there is no intrinsic factors. Small bowel disease, محل ما بصير الابsorption. Okay. Elderly patients or people are susceptible because they have decreased gastric acid. The function of the stomach is low, below the normal, so they can have vitamin B12 easily. في عندنا drug مهم اللي هو الميتفورمين. Metformin is known in Jordan as glucophage. Okay, هو one of the drugs used for diabetes. It is very commonly used, and this one is known to inhibit the absorption of vitamin B12. Vitamin B12, in addition, it is important for the synthesis of myelin sheath. Okay. Other functions, أول إشي, it is important for recycling tetrahydrofolate. Okay, يعني حتى لو الفوليك acid كان موجود, الفيتامين B12 is essential for its function حتى يعملنا recycling له. Synthesis of myelin sheath, okay, around the nerves. So if there is no vitamin B12, there will be abnormal myelin, decreased in amount, and the nerves becomes injured easily. Synthesis of neurotransmitters في البرين like dopamine and serotonin, they are important, vitamin B12 for them. And metabolism of homocysteine. Homocysteine is a metabolite that is toxic to the neurons. So when we have vitamin B12 deficiency, homocysteine will rise. So the patient will become more prone for neuronal damage, and also homocysteine is it is important for the development of cardiac diseases. Okay. Now the degree of neuronal damage doesn't correlate with the degree of anemia. هاي بالفيتامين B12 deficiency. ممكن واحد لسه الأنيميا مش طالع عنده, he or she doesn't have overt anemia, but they already have damaged. طيب, morphology of megaloblastic anemia. Remember the name mega, it is a large. RBC becomes macrocyte, bigger than the normal. Okay, if you see the blood film, you see a lot of macrocytes. في عندنا tendency to becomes more oval. هاي characteristic للmegaloblastic anemia. في عندنا other causes of macrocyte راح نحكي عنها later on. But the only one that makes this elongation تكون more oval in shape اللي هي megaloblastic anemia. Neutrophils also it has a characteristic, بيكون عندنا more segments. النيوكليوس تبعت النيوتروفيل is segmented. Normally it is segmented. عدد segments from 2 to 4. في iron deficient في megaloblastic anemia it becomes more than this. Okay, like in this picture we have at least 7 segments. Why? As we mentioned, because it takes a longer time for the cell to mature, so we have more chance for segmentation. حجم الcell also is bigger than the normal. It has more cytoplasm. Cytoplasm can grow without the need of thymidine, so it keeps growing until the cell is mature, and thus at the end we have a large cell. Symptoms, remember it is a chronic anemia, so the patient will have the general symptoms of anemia that we mentioned in the last lecture. Glossitis, like in iron deficiency, بصير عندهم beefy tongue, بيكون very red نتيجة الانفلامation. Remember الجوندس لأنه عندهم minor hemolysis as we mentioned, but it is different from the hemolytic anemia, بيكون very mild. Okay. Now in severe cases the bone marrow all cells they fail. بطل حتى anemia, حتى not only anemia, also the white blood cells and the megakaryocytes they fail. They all of them fail. وبالتالي there is no production from the bone marrow. In vitamin B12 deficiency, remember في عندنا neuronal symptoms is important. والcharacteristic في spinal cord يصير عندنا damage للposterior and lateral columns. يصير فيهم degeneration نتيجة loss of myelin sheath. بالتالي patients they have loss of proprioception. They complain of paresthesia. Paresthesia like the numbness, نمنمة في الأطراف, and it is a bad one, مزعجة. And loss of proprioception اللي هو self position. Okay, بصير عندهم بصير عندهم loss of balance. The patient cannot recognize how he is sitting or how he is moving well, they are prone to falling. Peripheral neuropathy نفس الاشي في outside the spinal cord. Peripheral nerves بصير فيهم damage, بصير فيهم نفس symptoms, loss of sensation or motor. And آخر اشي neuropsychotic symptoms can also develop في severe megaloblastic anemia.